And uh, what is your approach to patient communication and community-based interventions? We talked a little bit just now about, bringing maybe the grandmother in. Are there any other programs or methods to communication that you found to be particularly effective in having those types of conversations?
So yes, there are lots of methods I've utilized in my practice when it comes to talking to children and parents about obesity. The first thing is just understanding the development stage of the child. That's one of the hardest things for pediatricians is we have to know what development stage the child is in. So if you're talking about a newborn or a toddler, they have no control over the foods that they eat. So the conversation should be targeted at the caregivers and the people that are preparing the foods. But if you're talking about a junior high kid, my conversation is with the junior high kid. And my typical thing is, are you eating Takis and tea, Arizona iced tea all the time? And most of them are like, yeah, how did you know? Because I see y'all all the time. So then the conversation becomes a little bit more tailored to what the child can do differently to kind of mitigate those things. And then as an adult or as an 18-year-old, I can just be frank with you and say, hey, let's test and see. Do you have prediabetes? Do you have high cholesterol? Because I really need you to understand that your health is important. So it depends.
And then, as far as research goes, what gaps do you see in the current research regarding this topic, and what would you like to see the research field focus on more?
So, when it comes to research and obesity, that is a very hot topic because, especially in pediatrics, we are moving towards treatment. Since I started having an interest in obesity, back when I was in med school. I started med school, I don't know, 2008, 2010, something like that. There wasn't any real treatment. It was always eat right, exercise, eat right, exercise. But now that we have new GLP medications on the market and we have new ones, we have like 6 or 7 more that are coming out in the next 3 years. We have a lot more that research that treatment is changing. And so now kids over the age of 12 can get semaglutide to treat their obesity. Of course, it's not a catch all and it doesn't treat all obesity because it is multifactorial. Like I said, you could have Beckwith-Wiedemann or Prader-Willi syndrome, which are genetic conditions that cause you to be obese that these medicines may not treat. But there's a lot coming down the pipeline, and with research, I see it being more focused towards treatment for obesity with GLP medications.
So, when it comes to populations that are most likely to be adversely impacted by obesity and the negative life outcomes that might come with that, such as populations of low socioeconomic status or ethnicities that are more likely to be negatively impacted. What do you hope to see in the future, and what would be your message for doctors as they serve these groups?
Great question. My word would be have a little compassion. I see a lot of parents and children that have struggled with obesity or overweight for many years, if not their whole life, and they don't feel like their provider, practitioner can truly understand it. They've been told, oh, you ate one too many sandwiches or you didn't exercise enough. And just understand that obesity is a chronic, relapsing condition. So even when you think you have it under control, you have to continue to work at it. And the same solution may not work on different people. So have a little compassion for those that suffer from overweight and obesity.
Well, this has been an amazing conversation. Thank you so much for joining us, Dr. Everhart, on MD Newsline podcast.
You're welcome. Thank you.